Pooja Mehta to the stage. She's a full-spectrum obstetrician and gynecologist practicing in Louisiana. She's also a health policy expert and a fellow with the Physicians for Reproductive Health, where she advocates on behalf of comprehensive reproductive health care across the country. Please welcome Dr. Mehta!
Good morning, y'all. This is amazing. It's amazing to be here. I can't believe I'm here. I am so proud to be an obstetrician and gynecologist practicing in the beautiful and resilient state of Louisiana. I am really honored to be here with you and with the brilliant people who are carrying this movement on the ground in my home state. I became an OBGYN because I wanted to show up for people in their moments of need, with science and knowledge and empathy and skill on my side. During the intimate moments of childbirth and cancer treatment and miscarriage and more. I'm here today because lawmakers in Louisiana have simply gone too far. The people I serve already face numerous obstacles and drive many miles to get to care that they need, care they cannot find elsewhere. Safe, kind, and reliable care provided in freestanding clinics in my state. This care does not require admitting privileges. As a doctor, I can tell you that admitting privileges do not make abortion safer, they challenge access. Abortion in Louisiana is already so safe that providers rarely have to send someone to an emergency room, much less admit them to a hospital. Hospitals may decline privileges to abortion providers for this reason, but also because of stigma against the very providers that they are sending their own patients to when they need necessary care. Or because of fear of an increasingly complex set of rules and regulations around the provision of abortion. I am saying this as someone whose job it has been to advance quality and safety in care. We know that Louisiana has one of the highest maternal mortality rates in the country. We know that Black women in Louisiana are 4 times more likely to die compared to white women, and that many of these deaths are preventable. This is unjust, and we are working so hard in Louisiana right now to change this reality together, inside and outside of hospitals. But some Louisiana lawmakers say they value the health of mothers, say they trust women, and continue to strip access to critical healthcare services away. They are talking out of both sides of their mouths. You either trust birthing people and their families to make decisions for themselves and build the systems that support them, or you don't. Let's say this together. Abortion care is health care.
Abortion care is health care.
These lawmakers' goals of eliminating the number of providers who can safely perform an abortion is what is truly dangerous, and it is already having a specific and an alarming impact on the communities where I live and work. In fact, the courts have already upheld my medical opinion once. Unnecessary requirements like admitting privileges will make healthcare even more difficult to access by taking skilled providers out of our communities. In Louisiana, this will potentially leave us with just 1 remaining clinic in our state. This is what's dangerous. What is this? Say after me, it's dangerous.
Dangerous!
I call on the Supreme Court not to give in to this culture of fear and stigma and misinformation. A culture that erodes in particular the rights of the disproportionately low-income, Black and brown, and trans and gender non-binary people who cannot buy themselves out of the impossible system that we are creating. And they should not have to. So let's honor the lived experiences of people across Louisiana. Honor us, quote-unquote, third-party healthcare providers who will always use our voices to elevate the unheard needs of those we serve. And let's remember that politicians have no place in the relationship between patients and their healthcare providers. Thank you so much for being here for this amazing moment. Thank you for your time and your energy and support. Let's keep the energy up. Let's take the energy home and onwards towards justice and safety and dignity and